Hi everyone, my name is Ania Bartholomew and I'm a third-year medical student from Ohio University Heritage College of Osteopathic Medicine. And today I hope to enlighten the audience about the nerve complications after regional anesthesia and foot and ankle surgery avoiding the popliteal fossa. So let's pretend that you're clumsy like me and over the weekend you took a fall down a flight of stairs, you broke your ankle, and now you need surgery. In terms of anesthesia, you'll most likely be receiving a popliteal nerve block, which is a common procedure used by anesthesiologists to augment intraoperative anesthesia as well as provide post-op pain control. Complications of popliteal blocks can include pain, numbness, and foot drop, sometimes without clear resolution. Through an extensive literature review, I have found that recent studies show that complication rates may be higher than previously expected at around 10% in the short-term period and 4% extending to the long-term period. Interestingly, of those 10%, 9% of them were sensory and the remaining 1% were motor. Our study aims to address the complication rates from using an alternative anesthetic procedure, a distal ankle nerve block, for similar foot and ankle surgeries. While this block is known to provide equivalent anesthetic properties and pain relief as the popliteal blocks, we focus on the effects of this method on the incidence of motor and sensory complications following these foot and ankle surgeries. So before we go any further, I want to address two main questions. First, what is a distal ankle nerve block? This block focuses on regionally anesthetizing the 5 major nerves of the foot rather than the entire lower leg via the popliteal fossa. Second, if popliteal blocks are the gold standard, why should we use a distal ankle nerve block? Well, in addition to providing great long-acting postoperative analgesia, an ankle block impairs ambulation to a smaller extent than the popliteal blocks due to the lack of proximal leg involvement in the calf, making it a great option for outpatient surgery. We retrospectively reviewed the charts of 128 patients who received a distal ankle nerve block for various procedures such as ankle scope, ORIF, and lateral stabilization as performed by our senior author, Dr. Nicholas Cheney. Our studies show that only 2 patients were found to have sensory deficits, resulting in a 1.5% complication rate. 0 motor complications were reported from patients receiving the distal ankle nerve block. So as complications can sometimes result in life-altering disability, the absence and markedly reduced incidence of motor and sensory complications show that regional anesthesia avoiding the popliteal fossa can improve intraoperative and postoperative prognoses for various orthopedic foot and ankle surgeries. Thank you for your time and have a great day.